Andrea,
Hi.
good afternoon.
Good
Thank you
afternoon.
so much for being with us today.
Thank you.
We're very excited to have you, and we really like to learn more about you,
Right.
your work with the Latino Caucus, and about the Latino Caucus.
Sure.
Would you mind to share with us your name, what you do, and what is your role with the Latino Caucus?
My name is Andrea Jacobo, and I am the Young Professionals Committee Chair. And my role in the Latino Caucus is developing young professionals into the Latino Caucus, but also creating a mentorship program that helps young professional elevate to a higher position in their careers, but also giving back at the same time to younger students who are interested in public health.
Fantastic. Now you say public health, and we're talking about public health.
Yeah.
For those people who are listening to you and have no idea what public health is, what would you tell them?
Public health is everything in your life. It's the water that you drink. It's how much your sidewalks, how big your sidewalks are. If you have fresh available food, public health is that help in order to help you live a longer and healthier life. It's in everything. I would say it's omnipresent. You would say public health.
Interesting. So, a lot of people think of when they talk about health, they think about a hospital, they
Right.
think about doctors, they
Right.
think about nurses.
Right.
How different is public health from that?
Public health is different because we not just treat the individual, we treat the community. What's the larger aspect of their lives. So we look at how your community is built, what resources you have, what's the policies within that community. So as much as we want to treat the individual, we also treat the community at large, because we know in public health that everything is interrelated. So where you live really affects on how you live your life and how your health is as well.
Great. So that's a very different understanding for most people about health. So thank you for sharing. But what motivated you to join the Latino Caucus?
What motivated me, actually, it was the fact that I'm in Memphis, Tennessee. There's not many Latinos. However, it's a growing population, and I find myself as one of the advocates for the Latino community. And I want to find a way that I can create the system that has longevity and sustainability. And looking around me, there's not many Latino young professionals or even Latino health professionals in my field. And so with the Latino Caucus, I can reach out beyond my city to bring stuff into my city. So that's what encouraged me to join the Latino Caucus.
Good. So it sounds like the Latino Caucus kind of help you expand the work that you're doing and reach out to much more people that you could do on your own.
Right, exactly. And right now, there's a need for a Latino coalition on health, and just a Latino coalition in general. And we're in the works of creating that coalition, and reaching out to people in the caucus will be helpful for me to develop a coalition that is sustainable, it's for the people, by the people. And so I'm really excited about that.
Great. And I know you mentioned young professionals and you mentoring. Why is that important for the Latino Caucus?
It's important because a lot of us are first generation. My mom still doesn't know what I do. So I really can't lean towards my mom to ask her, Mom, where do I go for this? Where do I go for that? I can't do that. Not because she can't guide me, she just can't guide me in the terms of public health. So the mentorship program is guiding you in that public health field and looking at your skill sets that lend towards a career path that you may have not even thought about. So that's why I wanted to start this and create this 3-tier system that I spoke about, because it's important.
Great. And for those people, young people, as you mentioned, who are out there and who are curious about what you're saying, what would be your advice for them?
Curiosity is important to have. It's the development or courage to actually take this first step. Asking that question it helps you towards your life, right? So I would say use that curiosity in action. To ask questions, to reach out to people, to say, hey, what do you do? I'm interested in what you're doing. Um, that is going to propel you forward and open up many doors that you may have not thought about.
I see.
Yeah.
And we asked this question before to some of the other members of the Latino Caucus, but um, in what way is the Latino community different, or is not any different from other communities? What is it about the Latino community that makes them unique?
I want to say the sense of community is already built in our values. There's always hacerlo para la comunidad. Like you have to give back to the community. You're part of something. It's not just an individualism. It's community based. So we are in essence the valued through public health as well. I always say that we work with each other, and that's existent in a lot of other communities. But I think in the Latino community, it really is embedded in our culture and in our upbringing as well.
Great. And I know APHA 2018, the theme is health equity. What is health equity for the Latino Caucus?
So health equity is having to walk into a room and not say that you're a Latino. Health equity is having to have the resources that are there to help you move along and say, you know, we're going to move the needle of health by in your terms. It's not creating a division between people. It's unison among all, and it's making sure that we have what we need, not what they think that we need to move forward.
Fantastic. And for those out there who are listening to you and who are, learning about the young professionals, learning about mentoring, and but they are like living in areas where they don't have much access to any of information or universities or anything like that. What are some of the options for these people who want to be part of of what you sharing with us today?
If you're interested and you don't have someone around to help you to provide information, reach out to us, APHA Latino Caucus. We're on Facebook, we're on Instagram, we are on Twitter, and reach out to us. You can even use our email to email us. We have our website up as well. So reach out to us. We will provide you the information right to you through your email. We're in an age of information, so internet access is so important for us to communicate. We can instantaneously connect with someone across the world without having to go through many hoops like it were before. So just reach out to us. We're here for you. We are here to provide you as much information so you can move forward.
Thank you for sharing that. And what about if they say, I really like to find a mentor?
Right.
What would you tell a person who asks you that question?
Well, we can find you a mentor. We can find someone, we're a part of a network of 800 more professionals who are in public health. So you just let me know, where are you interested to look into? If you're interested in social work, public health. If you're interested in nutrition, public health. Policy, public health. Whatever that you're interested in, we will find someone for you in our network.
Great. It's so exciting that the work you're doing, what the Latino Caucus is doing, and that you're offering these opportunities to young professionals and students, I imagine.
Yes.
So we are very grateful, for you for sharing this with our audience.
Thank you. I'm very grateful to be here, and thank you very much for the opportunity.
Thank you very much, Andrea.
Oh, thank you.